Welcome back to another episode of the Gaslit Truth Podcast.
Hey,
Hello.
everyone.
Hey, I'm Dr. Teralyn. I'm here with therapist Jenn. And I just have to start this off with last night, Jenn and I were able to meet in person for the first time in like a decade.
Yeah.
A decade.
Uh-huh.
And when I told my husband, I said it was funny. I said, "Did you see me?" I said, "I did the slow motion, dun 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 dun
And
dun."
it was
As
what
we
was
were
really
like,
crazy is we both start doing it.
yeah,
And okay, here's the other thing people need to know. We're in a library.
yeah.
We are in a public library when we met last night. And I'm watching people around me watch us. I'm like, I'm loving this. Because
I
here
didn't
we
even
are.
care.
I know. I'm like, this is fan freaking tastic.
Yes.
And like it was. 12 years, right? Like you
Mhm. Yeah, I've
develop
been
a
gone.
relationship
Yeah,
with
I've been gone for
someone.
12 years, right?
12
Mhm.
years, right? So we met
Yeah,
maybe like once somewhere in there for a
right.
lunch. But that was probably about, 10 to 12 years
Mhm.
ago. And that's
Yeah.
it. And even now, working together for over a year in the same practice,
Yes.
everything we've done has been virtual. We have
Right,
yet to actually be in person for anything.
right,
And so it
including the
was
podcast.
right.
Yeah,
Like it was
all of
so
it.
symbolic, right? Like I'm like, oh my God, it's her in the flesh. I mean, she's real. And so
Yes.
that was such a that was a feel good moment.
It was, and I was happy to have it, but I thought it's just interesting, like, how you can do all these things still
Yes.
virtually and
Yes.
never meet, but I do have to say, since we re-met, it feels like we never lost
I
touch,
know. It
which
is
is
kind of
so
weird.
crazy,
It is kind of
you know?
weird.
It is, it's very weird.
Yeah.
So here we are today after our wonderful meeting last night,
Yes, we had a
with a
meeting last night, and
Mhm.
just so everybody knows, Terry may bring in just a little bit of her 1-900 voice today, just because I'm kind of at like an 8 or a 9, and so her soothing
I
voice
gotta
is
even
helpful
her
for
out
me.
today.
Yeah, so it's like it's those things that you do when you have this partnership, right? Where, like
Mhm.
sometimes someone's at 80% and the other person's only at 20.
Yeah.
And you just that's okay. Cause I feel like Terry, today your percentage, you can give a lot more than I can give today. So including your good 900 voice that calms me down. So
Well, it's interesting because when I work with clients, like, especially if there's, like, someone who comes in super anxious, um, I find myself going, "Okay, wait, don't meet their energy, like, you gotta,
yeah.
like, bring her down, like, you gotta,
Yes.
like, calm
Yes.
the room here,"
Yeah.
so it's very interesting because I try to not match the energy of the client
Yeah.
usually, uh, but obviously meeting them where they are sometimes too, but I try to,
Mhm.
be the calming energy in the storm
Yes.
sometimes,
Yes.
so,
Hey,
yeah,
this therapist needs therapizing. I mean, let's be
we
truly
got
honest.
you,
We
it's
yeah,
fine.
we are our worst
Yeah,
enemies when it comes to knowing what to
mhm,
do, but we don't do it.
correct.
Like I
Mhm,
will raise my hand all day long in that
mhm,
be in that school because that happens a lot
yeah.
for me. And so
I think
yeah,
it's just a common thing because 'cause we're just all human, so
that's very true too. That is
mhm,
very true. So
yeah.
so yeah, so you get our intro going here for everybody and tell us what's going on here today. What are we doing?
Alright, so before we do, make sure you like, comment, subscribe, do not miss an episode. We need support.
We
We love
do.
support, and we love your comments too.
Yes.
Which shoot, I forgot to pull out any comments for the
Oh,
day. Oh,
don't worry.
Jen, you've got
I
some?
got one.
Oh, let's hear it.
As messed up as my brain is today and the
You
inability
found
for me
one.
to regulate myself,
Nice.
I do. I have a comment and I wanna
Yeah.
read this. Okay, if you're okay with this and the props. Now, in this comment, the props is going more so like they bring both of us into play in this comment, but I am going to tell
I
you
just
this
need
one's for
props
you.
for myself to
This no,
keep
this one's
going.
for you. This
Oh,
one is for
geez.
you, Terry.
Alright,
So
let's
so
go.
we had somebody comment on our YouTube channel, and it
Mhm.
was actually a couple days ago, and it was on our episode that we did on iatrogenics and broken
Oh,
promises, right?
okay.
And I'm going to read this. So the comment says, "I just want to thank you both.
Mhm.
But Dr. Teralyn, I found you on TikTok and you have been a godsend for me and
Shut up.
helping me not feel crazy for thinking that antidepressants made me even more crazy. I wish I had known what I know now so that my kids in their childhoods could have been better." And then she has a little tear right there. And she says, "I'm trying hard now to show them a better and healthier way. Thank you too for helping with that." So this one was for you.
I'm all misty-eyed right now,
This
for
one was for
reals.
you, but that was from that comment came through 2 days ago, and I'm like, that's, like, awesome.
I need a tissue.
But it is though, like, and I knew you didn't see it. I knew you
I
didn't see
didn't
it.
see
No.
that.
And I
No.
responded to it, and I'm like, and then we're gonna talk about it because I knew we were gonna be meeting, and so doing this, and I'm like, I know she didn't see this, so I wanna
I
be the
did
one to
not.
give that to you.
Oh,
So
man, like, I am I mean, when I
so
hear stuff like that,
so
like,
thank you, Melissa. That was from Melissa.
thank you so much, Melissa, like,
Yeah.
this is the whole goal, isn't it? And sometimes, like, I feel like I am, like, out there and obnoxious on
Yeah.
TikTok, like, I'm this obnoxious pain in the ass, you know? But when I hear feedback like that,
Mhm.
so many people hide in the weeds, right? Like, they're
Yes.
watching and they're hiding in the weeds because there's a
Mhm.
whole other group of people that dulls out their voices,
Yep.
right? Like, there's no way you can feel this way because, these meds only save
Yes.
lives,
Yes.
and if you think a different way, then you are crazy, and I'm like,
Yeah, and that's
"Yep.
her experience, right? Like,
Yeah.
she was meant like, felt nuts for
Yep.
being told, like, "No, this is the
Mhm."
solution." For some reason, it's just not it's not working for you,
Well,
but
I
this is
mean,
the solution.
she felt nuts for being gaslit, which is the definition of being gaslit, by the way.
Exactly, that's exactly what the whole basis of this
Yeah.
podcast is about.
Yes. We
Right,
need
and
we need more comments like
we
that because they
do.
really help keep us going, and it really when I hear that, like, it helps me it does, it helps me keep
It
making
does.
content and going and
It
things
is
like that when I
such
know that I make
a
a difference.
it's a deep return on investment that
Yeah,
isn't a financial one, right? That is
yeah,
that is it's that same feeling that I get with
mhm,
clients when they can say, like, there is a change.
yeah,
You helped with that change, but I feel so empowered now. Like
yeah,
that those moments are the teary moments even with clients where it's
yeah,
just like, yep, that this is why we do what we do
yeah. It
right there.
100% is, and when I first started introducing more brain health to clients, I would do it in such a sheepish manner because it felt so woo-woo out there,
Yeah.
right? Like,
Yeah.
so new agey and whatever and against the grain, and I'd be like, "Would you like to try
Yeah.
some tyrosine?" And I'd be like and then I
Yeah.
would back out of the
Yep.
conversation real fast, and then
Mhm.
I wouldn't say anything about it again, and those people would go get tyrosine because 'cause I'd tell them where to go get it, and they'd come
Yeah.
back, and a couple weeks later, be like, "Did you ever think about that tyrosine?" "Oh, yeah, I've been taking it for a couple weeks, and I feel better," and I'm like, "Why didn't you tell me that?" Like, number 1, why didn't you tell me that? And number 2, thank you for telling me that, and number 3, this shit is
Yeah.
not wild and crazy. Like,
No, no.
this
Mhm.
is
Yeah.
yeah, I mean, food
Yeah,
is
no.
fuel, that's what it is, so but that's a good segue into today's topic is,
Yes.
a kind of a dual topic here.
Yep.
It's polypharmacy, and
Mm.
it's also med washing. So we're gonna kind of combine those 2 things into one, and maybe one day we'll have to break them out into 2 separate ideas. Who knows?
Yeah,
Who knows where we go with this stuff
well,
sometimes.
and that yeah, we could go really far with it too because just like
Yeah.
how so you gotta tell everybody about like here you and I are at like 9:30 last night,
Yeah.
okay? And this is downtime, right? Like, it's time to slow the body, slow the mind, go sipping the night, right? And you and I are like, "Oh, no.
Texting
Oh my
topics.
gosh." Sending all of
Yes.
these Medline articles, right,
Mhm.
about polypharmacy and
Yep.
about med washing, and then I'm going in my brain to actually experiencing, not personally for me, but, like, in my last career, watching people go through the med wash, right? And then, "Oh my gosh, like, what happened if I would go through a med wash like this?" And then it's okay, then there's
Yes.
all these people on TikTok that are responding to us saying, "I did this, and here are the
Mhm.
effects on my life." And so, of course, here we are like 9:30, 9:45, like, and I'm
Did
texting
you
and
see
I'm
this
reading.
one? How about this
I
one?
know, I know, and I'm, like, talking to myself because 'cause I'm
Yeah.
like, "Oh my god, this is so intriguing," so we're jacked up a little bit
A
about
little
this, so
bit.
this might fit
If
this
you
into
guys
about
don't
40 minutes. It's gonna be
mm,
hard, and we'll
yes,
probably have to do another one.
probably. This might be part 1 of 2, I don't know, or
So
3, I don't know. But if you
uh,
guys don't know what polypharmacy is, I lovingly refer to it as med stacking. Like, it's
okay,
when you have
it is.
well, polypharmacy is defined by 2 or more psychiatric medications.
Yep.
I think it's should just be 1 or more than 1 is
Yes.
polypharmacy,
Yes.
but the definition is
Yes.
more than 2. And as I was thinking about this definition, yes, I saw it a ton when I worked in the prison. I see it a ton in private practice,
Yeah.
and I see it a lot more when we talk about kids. And I think
Mm,
part of that is because, parents want what's best for their kids. So that they're going to be,
yes.
especially when it comes to stimulants,
Yep.
right? So for stimulants, for sure, kids and adults, you can't get something for nothing. And often a stimulant makes a child or an adult more aggressive. So then they're put
Mhm.
on a mood stabilizer or
Yes.
something.
Yep.
And then they can't sleep at night because they're on the stimulants. So then they get put on a sleep aid so that they can sleep. Now that's called polypharmacy.
Yes.
And adults get the same thing, but I do see it
Mhm.
a lot in kids almost unquestioned. I don't know, like, there doesn't seem to be a lot of questioning when, "Oh, yep, now they're on this because of this." If you go on any forums in Facebook, you'll see it. Parents are
Mhm.
just talking about it like this is just normal. "Yep, this is normal. My kid needs all these meds to stay upright." And I go, "Are they Elvis Presley?"
Yeah.
Like, because, I mean, if you remember, like, some stars, they're on, like, stimulants during the day, mood stabilizers, nighttime medications, like,
Sure.
just to
Oh,
keep their body going.
just to keep
Mhm.
going.
Just
Yes.
to keep going.
Yeah.
Yep.
And something that we're going to talk about today with polypharmacy too is and if you don't have a ton of knowledge on it, right? Like the other way I view it in terms of there's this med stacking piece.
Mhm.
But typically it's the start of it in when you look at the definitions of this, basically you're putting the same medications, different types of medications, but trying to treat the same ailment. So the
Mhm.
other thing that I think a lot of people could resonate with is this idea of I have depression, right? So I start
Mhm.
on an SSRI of some sorts or an SNRI, right? So I have depression and I start with this. And that depression itself doesn't necessarily get better. So
Right.
I need a
A
booster.
booster well, you see this on these commercials,
So
right?
that's the other thing I thought, because you
Mhm.
and I were talking about this, to wrap
Yes.
it back for people who don't have a ton of like awareness of what this could look like in real life, right?
Mhm.
There's another example. So I'm taking an SSRI for my depression, but then it's just not quite enough. And there's a
Right.
lot of advertising for this right now that you'll see out there. So let's put a
Yes.
booster on it to maybe, because maybe your antidepressant alone is just not enough.
Right.
So then we put that booster on there, and either of those meds could then create adverse side effects. Like all of a sudden, I'm kind of anxious when I wasn't. Okay, well, just put a
Oh.
little anti-anxiety, put some med on that for
Yep.
anxiety. So before
Mhm.
you know it, you've got a few on there, right? So that, which is kind of where you're going. But
Mhm.
a lot of times it starts with the single. We're treating the same
Yes.
symptom, right, or
Mhm.
category of mental health issues, and we keep stacking on that. And from a
Yes.
prescriber's view, it's not difficult to intertwine all of those.
Well,
You know,
I
you know?
want to circle this, and this could probably be podcast number 3 of 1, 1, 2, 3 is, the how we diagnose people,
Yeah.
right? Like, so there's so much diagnostic overlap
Yeah.
that suddenly you can have a
Yeah.
mood disorder, anxiety,
Anxiety
depression,
disorder. Yep. Mhm.
trauma, PTSD,
Sure.
all these things. Like, you could and then if you start treating each one of those things as if they are separate and individual things, now you've got polypharma,
Yes.
right? So
Yes.
instead of looking at it like which one of these things actually is the best identifiable diagnostic for me,
Mhm.
it,
Yes.
but so I think the two things are very closely connected.
Yep.
The overuse of diagnostics in the DSM and then partnering with polypharma on top of that. But I could be
Mhm.
wrong. I'm wrong a lot. So if you guys have a comment on that, we would love to hear it. Like, I want to
Yeah.
know what your comment is, because this is
Yeah.
just our lived experience, what we've witnessed.
Mhm.
But okay, so I'm going to go back to the experience that I had when I was early stage dealing with thyroid stuff. And when I went to the doctor that day, when I walked out of there with a stimulant script, a antidepressant, and a sleep aid in one one appointment. That was one appointment.
Yeah.
That would have been me being immediately pushed into polypharma. Immediately.
Yeah.
Immediately.
Yep.
With no
Mhm.
turning back. And so I asked, like, okay, so how would I ever have known if I was having a reaction to any of those if I'm taking them all at the same time and prescribed all at the same time?
Yes.
Like, how would I ever
Yes.
know which one it was, what was
You
going on, and what made me worse? Because I would guess if I actually took that, which I said absolutely not, I'm not taking any of these scripts. If I would guess if I actually took that, I probably would have discovered somehow that I had anxiety, and my guess would have been I would have been put on an as needed benzodiazepine because all of that would have just fucked me up, like
Yeah.
probably pushed me into
Yeah.
anxiety real bad. And then it would have been
Oh,
worse.
sure.
That would have been my trajectory likely. And I think that is a lot of people's trajectories, especially when, well, we're going to go back to the episode that we did on treatment resistant depression, right? Because I would imagine that those people who have been deemed that have been subject to polypharmacy, and
Yes.
higher doses of things, right? And so I
Mhm.
always get curious about this. Like, okay, you guys, if you are on a medication or two and you still don't feel better, you know, maybe it's the medication. I just want you guys to consider that maybe it's the medication that doesn't allow you to feel better. If you've been on a med for decades and you're on an antidepressant for decades or an anti-anxiety for decades and you still have depression, you still have anxiety, why are you
Mhm.
on that? Like, if you were to let me break it down. Okay,
Yeah.
if you went on a well,
Here
if
she
you
goes.
went on a blood pressure
All right.
medication and that blood pressure
Yep.
medication did not help your blood pressure, they would take you off that medication. They wouldn't say, "Well, just think about how bad it could be if you were off of this." If it didn't help you at all, they'd be like, "Nope, this medication is not helpful to you." In mental health, we go, "Here's the medication." And you go, "I'm still depressed." And then they say, "Well, just imagine how bad your depression would be if you weren't on this medication. So we're gonna keep you on this at this depression level because, wow, we gotta scare you into believing that if you weren't on this, it would be 10 times worse. So this must be doing the job that it should be doing for you." And I'm like, or alternatively, it
Uh-huh.
is exacerbating your depression over time. Like keeping
Yes.
you in a depressive state or an anxious state or whatever. But because we're too afraid to talk about it like that, people stay on it for decades upon decades upon decades. Also, because they can't get off, because, once you get off and you experience it worse, then, oh,
Yep.
you definitely need to be on. Like this goes, this is like a
Yes.
circular conversation all the time, all the
Yeah,
time.
it's like the dog that just keeps
Ugh.
in a circle chasing its tail. It just goes
Ah,
and goes and goes and goes and goes and goes. And I think, this is a conversation, I have had with many of my clients,
yeah,
recently, actually. And I 100% can sit and understand what that fear feels like when you've had something for a
yes.
very long time. I have several clients that are
Oh,
effexor,
yeah.
and they talk and the fear of like, well, but if I go off of this, how bad am I
Right.
gonna be? And I challenge that thought for them, and again, it's about their truth, but I'm like, "You what about considering the idea that, you've been on this and you're not actually doing
Right.
better." Like, you've been with me for quite some time, we're talking through this, things are not
But
getting
Jen, they just need
better.
that other
Um
medication to give them the boost at this point, right? Like,
Yes, and that's the conversation that happens then when they go into their
yes.
providers, right? Let's put something on top of this
Right.
effexor because it isn't quite enough. And I'm like, listen, you've been on that for 15
Mhm.
years. Like, baby, it is the treatment that is causing you
Right,
the pain
because we've talked
points.
about this
You,
before too,
you,
like, once you're on something for long term, your receptors downregulate. So, yeah, it's not
they
gonna
do.
make you feel good,
Yeah,
unless you
yeah,
add more
yeah.
or add something else, like, all these things, and so polypharma one area, and people aren't gonna like this, where I see polypharma happen a lot is within the addiction world. So, in recovery centers, things like that, you go in for detox, okay? And so there's this
Mhm.
acute withdrawal, which means like right now the withdrawal is happening. So let's just say somebody has alcoholism, right? Which can be deadly. The withdrawal can be deadly. So they'll get put
Yes.
on maybe a benzodiazepine or something and maybe something else, right? For that acute phase. The problem is that many people stay on that beyond the acute phase. Okay. So I just had this as a recent example. Someone came out of a rehab and they got put on 4 psychiatric medications in the acute phase of withdrawal from alcohol. And
Okay.
they never took them off of it. And so they've been on this for the acute phase for almost 10 years. And they were all,
Oh.
this is the other part. They were all central nervous system depressants, which means when
Oh
they're all
gosh.
combined, this person could have been in a coma or dead. Okay. So interestingly, I had run because I do this with all my clients. I run a drug interaction checker just because I'm like, what, especially when they show
Yep.
up with, 2 or more. All they need is 2 things.
Mhm.
I'll run the
Mhm.
checker just to see. And guess what? All of these medications that this person was on had a severe interaction with each other. All of them. And then you
Yep.
add on the severe interaction with alcohol on top of that. So, and I shouldn't be shocked anymore because this happens all the time, but every time I'm shocked, I'm like, you didn't know this? Nobody's ever talked to you about all of this. And the answer is always no. And I'm like, okay, from the prescriber to the pharmacist to therapists that you see, nobody's ever questioned all of these medications together and then alcohol.
And they all are central nervous system is what the function the focus was for these, right? That
Yes.
is what they were tackling in the
Yes. They
body,
were
right?
mhm.
So you have 4 meds that are highly contraindicative of each other to
By
be
the way,
on.
many of them were also, addictive themselves.
Okay. Well, sure.
Yep.
Sure.
Mhm.
Yep. Yep. Oh
Yep.
my gosh. So then what that does to a person,
Ha,
ooh,
ha, right?
I can only
Right.
imagine.
And then they
Yeah.
come to me wanting supplements as the answer, and I'm like, there's no way in good faith that I can do
Yeah.
anything with this until you have more conversations with your prescriber because,
Right.
number 1, your liver is in
Yep.
overload at this point.
I was
Yeah,
gonna
number
yep.
2, if
Yep.
you were to suddenly stop these, you'd be in a terrible position, but this
Yep.
person, what my point is not unique. This is not a unique situation.
Yeah.
Especially when you
I'll let the
yeah,
dog out.
who
You just
let the
keep
dogs
talking.
out? This person not in a unique situation, especially when they come out of a recovery center, right? Because
Yeah.
Frankie.
Killer.
Exactly.
Killer
Thank goodness.
Portuguese
So
water
Linus
dog.
is laying here behind me. Oh, there
Arr.
you can
I
see
know, I
him.
can see
Yep.
his little head. I know,
And,
I know. See, yours
he
is
just
nice
doesn't
and
give
chill
2
and mine's
shits about
crazy.
anything anymore. He
Yeah.
can't hear anything anyway except for me, and he's used to hearing me yak all day long. Uh, but anyway, so this is not the situation is not as unique as people might think it is, right? And so, especially
Yeah.
when it comes to women and kids, like women, kids, and people who struggle with addictions are like the top 3 for polypharmacy.
Yep.
And so there was a little bit of let's see, I wanted to pull up here. I found some stats on this. Just oh gosh, I think it said this is such a wide statistic. I was looking at how many people have polypharmacy. So how many people are prescribed 2, I'm sorry,
2 or more.
more than 2 psychiatric
Yep.
medications.
Yep.
And it was
Yes.
13 to 90%. Like you might as well just say all the people. I don't know. Like it just I'm like
That's
13
a
to
really great
90%. That's a huge range of ridiculousness to me.
right, and here's the deal too, when you and I know I'm
Yeah, go
kinda
ahead.
going off on a side thing, but when you and I always talk about, like, reading statistics or reading
Mhm.
research, right, and how some people
Well,
like, you can easily
percentages
just
are,
take that and
not good in
right.
research.
It could just say upwards of
Yes,
90%, and that sounds very different than
13 to
13
90%.
to 90. See, so, like, again, it's you get curious when
Yeah,
you see statistics because how helpful is that even? That could be twisted in a different
right.
way, right? Like, it's just well, what is the point of that? That's just it's I mean, sure, that was very
Yeah, I
helpful.
know,
Thank you.
right?
That was a
I
very
was like, I
helpful
was expecting
statistic.
to get some real
Yeah.
number here that was like, "Oh, wow, that's the real number, 13 to 90%." So Yeah,
That's super helpful, thank
exactly.
you.
So, basically, anybody could be subject to polypharmacy is what I just heard, like, any
Yeah,
person.
yeah,
And, even when we're talking to people, like, especially on TikTok and things, like, when I mention, like, if you're on one med, you gotta support your other neurotransmitters, and the immediate response to that is, "Oh, what other med could I be on that would do that?" I'm like, "No meds, like,
yes, no
like,
meds, yep,
nutrition, amino acids, like, all lifestyle stuff,
yep,
like, support yourself like that." You know? Don't just add
yes,
another med on, because 'cause I'm like, when I hear that, I get so disheartened. I'm like, "No, we're not heading towards polypharma for you. That's not the point." The point
yeah,
is, the least what do they call it? You don't go for surgery first, you go for, a shot or whatever. I keep
mhm,
wanting to say the least
yeah,
restrictive, but the invasive, maybe, the least invasive.
yeah,
So you wanna be if you're
yeah,
going to be on medication, like, you wanna be on the lowest dose of something, not the highest
yes,
dose. And if you keep having to
yep,
go up and up and up and up, you might consider that the medication might be causing more symptomology, but nobody considers that, you know?
mm. And that goes back to the premise of the
Yeah.
addicted brain. And that's really, and again, that's a very hard, we did an episode on this too, and only addicts can be
Right.
addicted. Um, yeah, no, no, like, we need to
Mm.
remove the stigma with that
Yeah.
word, and talk about what it actually means, because what it means is you need more of something over
Yeah.
time, right? And it's not as effective over time, so you need
Yes.
we're going to increase it, or we're gonna add something to it, and what happens is also when you remove that, then there's withdrawal, right? So when we talk about med washes and things like that, then or just decreasing on a taper, there is withdrawal, and that's
Yes.
what happens, right? That's what addiction
Mhm.
is. I mean, like, let's just call a spade here. That's what is happening inside of your
Right?
brain. Like, it just
R
is. But there's so much stigma with that word.
right.
Like, I say to that to my clients, and their eyes get just huge, and I go, let me explain to you what it means, because when you think addiction, you're thinking of some
Yes.
heroin addict that's on the streets. I'm not talking about that. I said my brain is just as addicted to Lexapro, and I'm going through this right now, watching myself go through
Right.
it, as yours is to what you're
Right.
taking.
Yeah.
And that's why you need more over time, because it's not
Right.
helping. Over time, you need
Or the
more.
one thing that it bothers me a
Yeah.
lot too is when I see people who get on something, right? And they're starting to
Yeah.
take it and they're like, "Oh, I feel terrible. Like I feel awful." And the response that most people have, even prescribers, is, "Well, just wait it out. Your body will become used to it." And I'm like, "Well, yeah, your
Yes.
body becomes used to heroin over time too. Or
Sure.
caffeine or
Yeah.
tobacco or alcohol or
And
pornography
yes.
or I don't
Yes.
know, like, and
Amazon
yes,
shopping. So,
yes, Amazon shopping, and I'm like,
dang it.
and I get DMs too about this, like, "This medication makes me feel bad, what should I do?" Well, first of all, I'm not a pharmacist, nor am I a psychiatrist, but I said I actually responded to somebody. No, it wasn't a med, it was a supplement. I think it was saffron, the supplement, and they said,
Yeah.
"Saffron makes me feel anxious. Should I just wait it out until my body adjusts?" And I said, "If something makes you feel terrible, stop doing that something that makes you feel terrible."
Right.
Like, even supplements can make you feel terrible. All these
Yep.
things can make you feel terrible. So, but we're
Yeah.
in the mental health space. We are like, if it makes you feel terrible, then thumbs up to that. We just got to wait it out, or I'm going to give you more. I'm going to increase your dose because now you're feeling terrible. So here, that's not the right dose for you. Like, counterintuitively, if you drink Drano, don't drink Drano, but if you drink
Don't
nobody would
drink Drano.
say, "If you
Yeah.
drink more of this, you'll get adjusted to that." Like, just drink more of it, you'll be adjusted. You don't drink Drano because your body inherently knows that it's bad, or I'm gonna say expired milk, right? So,
Oh,
if
sure.
you grab a jug of milk, and what's the first thing you're gonna do? You're gonna smell it, and your body is gonna give you the signal that it doesn't want it or it's okay, right? Like, or
Mhm.
if you put it in your
Mhm.
mouth because you didn't smell it and you like have this reaction to spit it out
Right.
because it is
Right.
poison to your body, right? But when it comes to psychiatric medication, and I might be going on a limb here, I don't know, somebody might have to reel me the hell back in. But when it comes to that and you take something and your body feels like shit, your body is telling you, "I don't want this
Yes.
in me. Like, I don't want this in me." And then we are saying, yes, you need it though.
Okay. So I don't think you're going on a limb with this, and I want to say this now, and I'm wondering if we're gonna, you think we're gonna have time to hit some med wash
Yeah.
discussion in here too? Okay. Like I have a hair issue. I keep doing this
I
today.
never know
Like
how to
I don't know
wear my
what's going
hair
on
in
with these
these
little.
things, so I don't even know.
I don't know
I
what
don't
the
even
heck's going on. I wish I could just not look at myself.
Mhm.
I'm gonna just do this, not look at myself. Here we go. Okay.
It's hard.
Okay. So one of the articles I've got
Alright.
it up here. Okay. Look at my little pop
I
socket
like
in here.
that.
Can
It
you
says the
see
Gaslit Truth
that? Gaslit
Podcast
Truth
on her
pop
pop socket.
socket.
I would totally do a
Oh.
pop socket, but it just gets in the way of my pockets and things, so I just don't like them.
I know. I
Mhm.
mean, it's obnoxious, but I'm finding that I can't hold my phone now without it because
You're used
I'm
to it.
like,
Oh,
it's
you're
just
used to it,
crazy, right?
Jen. At first, it was
I know.
uncomfortable, and then she
Okay.
became used. Oh, I don't know. Anyway, go ahead. Yeah.
Look
I
at you
know,
trying to
right?
tie
Mhm.
all this in, forcing me with the pop
Exactly.
socket. Okay, but this is okay. So one of the
Mhm.
articles I want to. Okay, so this theme
Mhm.
that you just said, I got really curious about this when I was geeking out last night reading these
Sorry to
articles, right?
interrupt your sleep, by the
And
way.
I know, I was like, I'm already I need to go
Yeah.
sleep night. Like, it's
God
my I
damn
do
it.
like, my sleep routine, which, like, I think this will be another episode,
Mhm.
right, is where we talk about, like, people being gaslit into what's really good for sleep
Yeah.
routines. Because mine is about as sacred as, like, Sunday mass would be to a Catholic equivalent in my world, right? Like, that is how sacred my my
Yeah.
evening routine is. So last night I broke that, though, because I was really
Okay.
geeked out about this. Okay, so this idea that we have to sustain and push through, whether it's a increase in a med, a starting of a
Yep.
med, right, or a taper.
Okay.
Okay. Okay, I want to talk about this for a minute because that theme emerges throughout, even when you're looking at some research. And this popped last night for me when I was reading this article. So, you guys, just so you know, there's this article that we have that we were going through, and it's specifically about med
Yes.
washing. Okay. It came from PubMed, and it talks about the idea of
Hold on. Does
polypharmacy.
everybody know what med washing
Oh,
is? Maybe just a little brief. Yeah.
we should, maybe
Go
we should,
ahead.
we should
Yeah.
talk about that.
Just real
Okay. All
quickly.
right. So I'm going to give like this
Mhm.
most simplistic version of this. So med washing is essentially when your prescriber, provider, whoever you're working with, is looking at your clinical picture and things just are not making sense, and you are on a significant, amount of
Mhm.
of drugs, right? Like, could you do a med wash with just a
Sure.
couple? You could, but typically these are people that are taking a
Mhm.
combination of classes of medications, right? You've got your
Yep.
anti-anxiety, you've got something else for mood. You
Sleep
might
aid.
have like some a
Antipsychotic.
sleep aid that's in
Yeah.
there, right? I was just going
Yeah.
to say the antipsychotics. My experience with med washes was with a lot of people that were taking
Oh, geez.
antipsychotics. And the med washes were being done with an antipsychotic and even something for mood. Um, I had this with a lot of clients that had borderline
Oh,
personality
interesting.
disorder.
Yeah.
Okay. And so they were on all of these multiple
Yeah.
medications, and things were not
No.
helping. And so the psychiatrist was at a point where it was like, okay, let's take and remove these meds
Yeah.
from the system. Now, oftentimes these med washes are not done in a hyperbolic fashion, which
Rarely,
is where we
rarely.
go
Yes.
low, we go
Mhm.
slow. And guess what? You're taking 4 or 5 meds. Let's give it a
Y
year
no.
and a half, and let's slowly start to decrease. Okay. Typically the med washes are done fairly
Quickly
abruptly.
and often done
Um,
more inpatient
yeah,
type settings or like Jen when we worked in the prison. So somebody is monitored.
yeah,
I'm using that term
yes,
loosely, monitored, but anyway, okay,
yes,
yes.
yes,
Over the
yeah,
course of a
yeah,
couple
and
days, maybe,
so
like mhm.
right. This isn't like what I'm doing right now, where I'm spending a year, just a year and a half to titrate off of an
Mhm.
SSRI. This is you're inpatient. We're actually going to remove these drugs from your system. We might add a few things to assist for a little bit to get you through it. Those will come away as well, so that you're like a clean slate,
Yes.
essentially. Right. So there is a benefit to a psychiatrist to do this, because I'm going to
Go
use benefit
ahead.
loosely because we're going to circle back to this. But there's a benefit to this because then it's like, guess what? We have baseline, which that word is bullshit. And we're going to talk about the bullshit baseline. Maybe that's what we should call
Bullshit.
this
Oh,
episode, because
I'm
that is
writing
just a
that
bunch
down.
the
Bullshit
bullshit
baseline.
of a
Mhm.
baseline. Like, come on. Like, so we're gonna empty your entire system of everything that you were taking. Okay. And then what we do in theory then is to go, let's add one drug at a time. Once you're all washed, you're clean, the clean clothes came out of the dryer, you smell downy, bounce fresh. And then we're just gonna add a medication then one at a
We're gonna
time,
do
right?
the
To
polypharmacy again.
we're gonna start it again, but we're gonna start at the
Mhm.
beginning, even though there is no
There is no
beginning.
beginning
It
because
your entire brain and body
have been
have changed.
jacked because of the
Yep,
wash.
they have
And so
changed.
this is what I sent to Jenn actually. And this is the part that I was like, "Oh, Jesus, this is terrible." Um, After washout, so this comes from a PubMed article. After washout, physicians may be able to select the appropriate polypharmacy more effectively and safely if necessary. And
Yeah.
because they're looking at that new baseline. Now new
New
baseline. So
baseline.
now Jenn, she is not in polypharmacy, but she is trying to, taper from Lexapro, right? And so and she's been very vocal about this. When she
Yep.
tapers, she has problems with a
Yes.
small taper, right? Like a micro
Yes.
taper. So if we were to say,
Significant.
"Jenn,
Yep.
tomorrow we are gonna wash this med out," you're just we're gonna yank it out, and that's gonna be your
Yank it.
new baseline. Now keep in mind that most of this is done inpatient, right, with polypharmacy, most of it is. So they
Yes.
can be monitored, right? But they're not there for
Yes.
months looking for protracted
No.
withdrawal, looking for
No.
what is your real baseline. And so one
Yes.
medication you take out and Jenn feels horribly
Oh my
anxious,
gosh.
right?
Yeah.
Yes.
I mean, and I've talked about
Yes.
this.
And the
Yes. Yeah. It
akathisia
has been
and
horrific.
yes, all those things. So now suddenly we're taking all of this medication that's literally propping this person upright. We
Yep.
are eliminating it from the body for a couple of days, maybe. And then we're saying,
Yep.
oh, this is the real you. This is the real problem. This is the real
Yeah.
you.
It's it's so crazy, which now I wanna read
All
something from
right.
this article when we talk about,
Yep.
med washes, right? So there's a couple different ones we're popping in between. So this one, what I found very interesting, which I'm gonna tie back into where I started with this whole tangent, was this idea that you must endure what is occurring because that's part of the process, okay? And I'm gonna put process in air quotes because, this is just how I'm doing it for those of you that might not be watching us on YouTube and you're like, I keep making faces and air quoting. Okay, so the following principles are found to be helpful, okay, for the people that wrote this article in minimizing the risks when tapering and doing a med wash.
Okay.
I'm gonna
I
read this to you.
cannot wait to hear
Okay.
these. Okay.
So the first, there's only a few bullet points.
Mhm.
There's a ton of them in here, and I do have to give credit where credit is due because one of them talking about a washout actually talks about augmenting with
Oh.
tyrosine,
Oh, whoa, whoa, whoa.
5-HTP,
Whoa.
okay, St.
What?
John's wort,
Mhm.
with okay, yeah. So of course there's like 15 bullets on here. That's the one right at like third from the bottom.
Yeah.
However, where it's in here doesn't matter, Jen. It's at least in
Yes.
there. So I'm going to give a little credit where it's due, but
Mhm.
it really negates, like, it doesn't negate the importance of the rest of this. Okay. So preparation and proper informed consent gains the patient's confidence
Oh,
and
yes.
support. Initially, this consists of the patient borrowing from the expertise of the provider.
Mhm.
So here I go back to this idea that you're an expert in prescribing, but you are not an expert in
Right.
deprescribing. We're doing a wash. So you don't have to be an
No, because 'cause you're
expert
just
in
taking it away.
deprescribing requires that you look at all that big
Yes.
picture. Washing does not. Okay, so yep, that's
Yep.
about right. Okay, so curious about this, people. Proper management of expectations can make the difference between a successful taper wash and a crisis. I'm going to give you the next
Oh.
part. Ready? Part of the preparation includes a patient understanding that there's going to be discomfort over the next few weeks. In fact, anticipating discontinuation syndrome, which is
Withdrawal. Mhm.
withdrawal. Okay, here we go. From an SSRI of dizziness, dry mouth, insomnia, nausea, nervousness, sweating, shock like electrical sensations, brain zaps, diarrhea, sensory disturbances. Educate your patient as to realistic expectations. So, in the way
Why did they
in
do that when they
which
were prescribed
we
those things?
this is what I'm saying, right? So this idea of, and I read this. So this is what prescribers These are helpful tips for prescribers
So
doing this that
helpful.
are
Yeah,
going
oh
through a
man, the
wash.
helpfulness of this is
So
just, insane.
so here you are, Terry, you're my patient, right? And I'm going, listen, you're so jacked up. I mean, you got so many
Mm,
meds in you. Let's do a
yeah.
wash, right? And I know that it's way more, of course, there's more conversation than that, but is there?
No, there's not.
So I there's a power
Well,
differential
also, I
between you
gotta
and
say
I
this,
right
if
now.
you are inpatient, often you don't go inpatient for a med wash. You are
True.
inpatient for
Yes.
something else, and the med
Yes.
wash is a
Yes.
intervention that you basically
Yes.
don't have a whole lot of control over whether you say yes or no to at this point, but anyway, go ahead. Mhm. Yeah, mhm,
Okay. Yeah. So all right. So that's actually a very interesting piece to it as well. You're
mhm,
right. Yeah. So here you are. We are working so hard to try to figure out why you are here inpatient. The interventions we are trying are not
mhm.
working. Okay. You are clearly significantly depressed.
Wow, I'm the
Okay.
patient
You
right now? Like, man, that sounds
significantly. Yeah.
horrible.
You're
Okay, keep
depressed.
going.
Yeah.
Like, man, I'm
Yeah.
I'm really
You're
fucked up.
depressed.
Okay, go
Yeah.
ahead.
Yeah. You are pretty fucked up. All right. And so and I laugh about this, and some people are like, "Oh, you're going so far with this." Listen, we did this in
Oh,
a
yeah.
prison and I watched it happen in
Mhm,
front of me, but I didn't understand it. Now I understand it because I have a different truth
mhm,
in this, right? And so we went through this with patients and we've tried all the interventions under the sun. You are on a inpatient behavioral unit because you
mhm.
are struggling so much. Mind you, now you've got it something for anxiety, something for sleep, you've got an antipsychotic, and you've got something for your mood,
Mhm.
right? And we've got 3, 4, 5
Why
meds
is
on you
this
right
not
now,
working?
and things aren't
Mhm.
helping. You're doing
Yeah.
therapy,
Mm,
that's not helping, right? You're doing CBT, we've got you in a DBT
no.
program, right? You're doing individual therapy every single week. We're even doing some rec therapy with you. We've got all the pieces, but you're still doing so the psychiatrist decides, "Hey, Terry, you know what? How about we look at this idea of you are on so many medications. Let's remove those. Get you back to a good baseline because I think along the way we've lost what's causing what because you are on so many meds and you aren't getting better. Let's get rid of that. Let's start over. Let's have a fresh start." And so it's going to be a little painful for a while. Okay. So if we're going to do a wash with you, this is what it's going to look
Mhm.
like. Okay. You're not going to sleep well. You're going to lose your appetite. You're going to get dizzy. You're probably going to vomit. You're going to have some out of body stuff. You're going to feel zaps in your brain. And actually, you might feel like a lightning rod that goes through your whole body because you're probably going to have a little panic attacks that are happening. The sweating is going to be bad. So you think you're menopause. No, sweetheart, you are not. This is what menopause is going to be like.
Mhm.
Okay. And your whole body is going to sweat. You're going to convulse. You're going to shake. And it's going to take a few weeks and you're going to have to endure that, but if you can do that, we will get to a baseline and then we can start
You're
over.
like, "Damn, that sounds like I have to run a
Yeah.
marathon without training."
And here's the thing that gets me.
They never say all
Yeah,
that,
it
that's the
does.
thing that gets me.
But but this is the thing that gets me too is part of this what I was just
Mm,
reading is this idea that it is okay to share with the patient the idea that you must endure this. Just like it's no different, Terry, than when we start meds now
mhm.
and they go through side effects and they say, here's side effects. You go, okay, great. And after like a month, you're still not doing well. And you call back and you're like, listen, it's been a month and I just can't. I am doing worse. And what have I heard so many times myself as a consumer and as a patient? I have heard, listen, you've got to give it the full
Right.
cycle, Jen. You've
You're
got to
not
give it
doing
the
it
full
right.
couple
You're not
months.
doing it right
It
yet.
at
Mhm.
least 8 weeks for this to really get into the body and for you to see those full effects. It's going to take weeks of you enduring pain and bullshit to wash this out. But when you do, there is something on the horizon that's going to help you. Okay. This idea is funneled throughout like all of it, even when we do an increase in
This
a
idea
med,
is
right?
really
Like
fucked
you're
up, like, it's just
think about this whole idea. So I'm reading this thing about this med
mhm,
wash, right? And I'm thinking part of the criteria that is given to the physicians doing the med wash is these are the things as a physician you need to know as a prescriber that's
mm.
doing this that you need to know. And one of those things is a realistic expectation is to tell your patient you have to go through this.
Yeah, that's the only time that they would ever tell their patient that they have to get off of it.
Right. But why would we do that instead of going, listen, let's do this in the best mind and body way
Right,
possible, which is not let's remove all these
right,
meds just
right.
like that. Why are we not doing a slow, taper. And I know that there's when you're inpatient and there's all this red tape
Mhm.
tied to it, right? Like we get 21 days with you at the most.
Maybe. Most
This
people
is
are
what's gonna
inpatient for
yes,
3.
like I
Yeah.
just went like
Yeah.
super far, right? But like, yeah. And so there's all of these strings
Mhm.
tied to this, which are bigger systems
Yep.
issues. But I go back to this original idea of how is that a thing that's okay to even sit and tell a patient, listen, part of informed consent is this, which by the way, that is not
No.
informed consent. That's only just a sliver of like
Right.
what's going to happen. Let's talk about the impacts of what's going to happen to your blood pressure, your
Mhm.
heart, your adrenals.
Mhm.
How about
Right.
inflammation? How about your brain? And so I'm going a little far on this. I don't have this in front of me, but I had somebody DM me on
Mhm.
TikTok and talked about this for
Okay.
them. And they went through a wash and there was 3 medications that they ended up going off of. And it
Oh, yeah. I
debilitated
believe
them.
this.
They went from a functional mother with 3 children, okay? I mean, she just told the whole story, right? 3 kids. She was, I believe, a nurse or
Mhm.
a nurse practitioner, okay? Um, Great job, steady job, had a marriage, had all the things, right? Like the white picket fence, all the dream. She was doing really,
Mhm.
really great, right? Went through this, lost her job, had one of her kids taken
Oh
away
my
from her because
god.
she couldn't take care of her children anymore. Her husband left her. She had to go on disability
Oh god.
because she ended up having so many medical things that
Popped up
happened to
later.
her.
Yep. Yep.
Yes, because her whole system, you
You
just
blew it.
literally threw somebody into a
Mhm.
withdrawal and their whole system lost it. Her memory is shot. I mean, she's going on and on telling me this, and I'm reading this going, "Oh my
Mhm.
gosh." Like from a
Yeah.
wash.
Yes.
Um, and of course, that never sustained itself. She ended up having to go back on things over time because she could not
No.
handle, right, the internal distress of what was
No.
happening. Like,
Well, I mean, that's like
so of course, like
reinstating, right? Like,
her
so
her thyroid, she never had a
oh,
thyroid
now she
issue in her
does, yeah,
life.
I'm sure. Mhm. Mhm.
Yeah, yeah,
Which is
total
really
wash.
interesting
So,
because,
but
like, I didn't have thyroid issues until after I was on an SSRI as well.
yeah.
What?
So it's
Yeah.
this whole
But,
alternate
I
truth
wanna
that
bring
comes.
this up because I wrote this down as we are talking about this. There is only one other population that we tell them that they must endure this cold turkey mess of,
Okay,
drugs, and those are addicts. Yeah,
addicts.
not alcoholics, usually not people with alcoholism because that could be deadly, depending, on whatever.
I mean, that withdrawal from alcohol is the most deadly of
Alcohol and
all of
benzodiazepines.
yes. Yep,
But a
yes, of all yep, so
as
we
we're
do know that.
talking about this, I'm like, we treat people with addiction issues terribly because, of course, you don't want someone to be on heroin forever, you want them to stop, right? But in that
Right.
stopping, they go through a lot of physiological problems, many, many, many. I would
Yep.
guess very similar to people stopping psychiatric medications, maybe worse, depending upon, if
Oh, I
pharmacy, whatever. But yet we don't
yep.
support those people either at all. It's just
No.
like you either do it or you die. Like you either wash this out or you die. And you might feel like you're dying while you're washing it out, but that's okay. That's the price you pay for being an addict.
Yeah.
Isn't that
Yeah,
weird?
and
Like I'm just trying to draw this comparison between psych meds
mhm,
and addiction because, the language that we use is important and we don't use the same
it is.
language in psychiatric medication as we do in addiction, even though it's the same experience. I mean, withdrawal is discontinuation syndrome, right? And
Yeah,
we're never
yeah.
addicted, to a
Mhm.
medication, but we are, you know, we
We
draw this
we
line
are.
between what we believe society feels is okay, and we have better language for that than what society deems is not
Yes.
appropriate, and we have terrible language for those people, you know?
Mhm. Yeah.
But yet we expect the med washing, right? Like, this person is gonna basically get washed out of their addiction with no support. Well, I'm sorry, maybe the support they get is polypharma.
Well, sure, because that's also one of the interventions
Right,
for you said
right.
heroin, right? So what do we put
Like
people
methadone,
on to
Suboxone,
help
whatever.
that?
Mhm.
Yeah, right? And so we bring that into
Yep.
play.
And by the
I
way,
just
during that
it
time,
makes me
now
so
now you're
mad.
appearing anxious, so we might be giving you, an anti-anxiety med or an antidepressant or while you haven't even reached your actual baseline to know who you are. It's the same shit.
Right.
It's the same thing.
It
What?
it
My brain
is.
is blown again.
And just let's take it to a really so we're at a higher level. If we take it down to just a really simplistic level when viewing this, the idea,
Mhm.
me, okay? The idea that I can establish a baseline,
In a couple of
okay,
weeks.
in a couple of weeks, or I'm gonna even, Terry, I'm gonna even say a
A
month
year,
or even
maybe
2
even a
months.
year.
I'm gonna say
Mhm.
that, right? Because what we know to be true is this is the other BS. Here's the shelf life in the
Yes.
body.
Oh, yes.
Here's the Oh, we're
Here's your
talking about the shelf life
half-life.
of
It
the
should
body.
be out of your system,
Here's
and
Yep,
then you're
yeah.
good.
I know.
Mhm.
Yeah, I always say
I like
I like
shelf life
shelf I don't
too.
know why I
It's
say that
good.
because it
Yeah.
is half-life. You're right. I had somebody correct me
But it feels like a shelf
online for that,
life.
and I'm
I
like,
mean, it's the same
"Is that
thing.
is that what you're focusing
Mhm.
on? Or you're missing my message here. My message is this idea that it does. The drug goes through the body. Lexapro, for
Mhm.
example, will be done and through the
Mhm.
body within 3 to 4 days. It's gone. It's this
Yeah.
small window, right? It's actually, I think, like 48 to
Yes.
72 hours is what it is. However, okay, that doesn't account then for what's going to happen and has already been happening to my brain
Mhm.
because things aren't working, things are sleeping, and so
Yes.
all of a sudden
Yep.
things are coming to the light. And it's like this idea that, so that's going to be my baseline.
Right.
Hot Mess Express is going to be my
Right.
baseline if I wash that out. Like akathisia, not knowing where I am, feeling
Mhm.
anxious, crying a lot, feeling like there's bugs crawling inside of my body and coming outside of my body. Because these are the things I experience when
Yeah.
I can only imagine what it would be if I just
Oh
cut
my
it out
god.
and not taper. That's your baseline. So, okay, give it a few more weeks. How long does it take for the brain and the body to reach homeostasis after years of
That is the
taking meds?
question. That's the question.
Okay, so right, so this word
Baseline is bullshit.
baseline is bullshit. It's bullshit. It takes account no individual
Nope.
experience, your all of the holistic pieces that go into your
Mhm.
lifestyle, right? Like all of that, your
Yep.
story matters. And so baseline is huh, it's like shit experimentation. It's like doing a very
Experiment.
unregulated
Yeah.
study
On you,
that
on
has
one
no
person at a time.
parameters. Yeah. And we can only give you so much support, especially if you're
Right.
inpatient, right? We can only give you so much support because that will only last so long. And then after a week or 2 or 3, we start up and start something else. Your body never actually got its chance to reheal, reach
Right.
homeostasis. Your brain never healed. And so your baseline is actually nothing but just a new problem. So you are being gaslit into believing that you have a baseline and you do not. You don't.
Uh,
You just have another new set of problems.
Damn, that's
It's like
profound.
it's like the cut
The
never
cut never
healed.
healed.
The cut never
No.
healed. Root cause was never
Mhm.
addressed in the first place.
Well, it never is. Well, rarely. I can't say never, but
It's so hard to
rarely.
get to. I know.
Rarely.
But that's really like what it is, and it's yet another quick
Mhm.
fix, which sounds so backwards to
Yes.
say, but it's another quick fix to then clean the
Mhm.
slate to start some new meds. We have a new baseline,
Here's a new
Jen.
med for you.
It's so
Mhm.
backwards.
I'd be willing to bet,
Gosh,
Jen, and then we have to wrap this up, but if you
we
went back
do.
to your doctor now and was able to have open conversations, because I know you've had trouble having
Yeah,
open conversations there, and you expressed how you were feeling, I'd be willing to bet that their solution would have been a different medication for you. Yeah.
possibly.
Or if you
Possibly.
go back in
Yeah.
there now saying, like, "My anxiety is heightened," like, all this stuff, well, how about a
Yeah.
benzodiazepine as needed? How about that might help you? Mhm.
Right. Yeah, you're doing your taper, but it makes sense that you're gonna have some of this going
Right.
on. So if you need a little
Yeah, here's another
assistance,
med. Here's
here's
another
this.
med.
Yeah.
Yeah.
Yeah. And so here we are putting me right back into that
Yeah.
cycle. My dog's doing this,
Yeah,
chasing the
chasing
tail,
the tail.
chasing the tail, chasing the
Ooh,
tail.
we have some good titles coming
Mm,
up too.
mm, mm. I got all the stupid shit that comes out
You
of my mouth,
do.
right? Like, they're
Again,
like, "Oh my gosh,"
you
I know.
do.
But yeah, this idea that you're gonna have to there is a theme throughout our
Mhm,
field, and the theme that emerges is this intervention is going to
mhm,
work, but you must endure the intervention and what goes along
mhm,
with it. Whether we're adding, whether we're
mhm.
washing, whether we're starting something
Yep.
new,
And
um,
if it
put
doesn't work,
you know?
it's a you problem. It's not
Yeah.
a med problem or a systems problem. It's an individual, personal problem that is you. Damn, girl. All right. Well, that was another we didn't know we were gonna get that deep today. I had no idea.
Yeah, was it well, that's
I
okay
love
though.
it.
You know what? This is it's a level of vulnerability that, I don't know if I've ever gotten to
Right.
myself either, gotten to this space, so it's
So
also
good.
very good and healing to be able to
So
share
good.
this part of the
Well, we
story too,
appreciate you
so
listening to the Gaslit Truth podcast. We would also love to know if there are topics you would like us to handle, you know?
oh,
Mhm.
yeah. Once in a great while, people will actually reach out and
Yes.
send something.
Yes.
I had somebody stop me a few weeks back too, and I was, and that knew I was doing this. They're like, "Can you talk about some
Right.
supplements?" And I'm like, "Oh
For
yeah,
sure,
don't
we'll
worry,
get there.
we'll be getting to
And
that."
we have a whole
Yeah.
bunch of guests lined up that you are going to
Me too.
love. We are going to love these people. So,
Yeah.
be close. Make sure you like, comment, share, and subscribe to all of our channels across social media and our individual channels too. And if you want
Yeah.
help with your brain health, Jen and I are available. So you can
Oh,
all of
yeah.
that stuff is linked to our show notes. Please go there. And in the meantime, don't get gaslit.